Let's come over to the wall. We're going to bring our arm into a cactus position, and we'll take the same leg as that arm back into a lunge to stretch out the calf, twisting away from the arm on the wall, opening up both the pec minor and our gastrocnemius. Make sure that front knee is tracking forward. There's a soft bend in the back knee as you drive the heel down so we don't go into hyperextension with that back leg. Pelvis is tracking and pushing forward as that back heel drops down. Make sure you tip your tailbone back a little bit to create some lumbar extension. That's going to feel great. Pull the belly in towards the spine. Roll those shoulders back onto your back. Keep your head up on your spine. Apple distance between the chin and the chest. Hear your exhales. And go ahead and switch sides, setting up for that calf and pec minor stretch on the other side. We're warming up before we learn our exercises for level 2 trampoline for sway back and flat back posture. So as you're breathing here, notice if you're locking out in that back knee, keep it soft. Push the pelvis forward in opposition of the heel dropping down, that back heel. Stretching out the calf for more range of motion once we begin on the trampoline. Also opening up the chest so that when we use the bands, there's enough range of motion that we're not gripping in the front of the shoulder or the chest. Instead, we're using the upper back extensors. Inhale, brace those abs. Exhale, let me hear that exhale as you twist away from the arm. And inhale, fog of air, twisting away. So for our first exercise, we're going to learn all 3 exercises on the trampoline, and then we'll begin our cardio burst. So only work at 50% effort here just to learn the exercises. You're going to need your lightest Theraband and your ball. The ball goes between the knees. The lightest Theraband you wrap from the ends, holding it like a jump rope to start, creating a serratus anterior hold, isometric hold here. From here, we're going to begin in the transverse plane, the turning plane. You're going to bounce 4 times with the knees soft, shifting over to your dominant leg for 4, turning for 4, and then turning back to center for 4, and then back to 4 center on both legs, 4 on the non-dominant leg, 4 turning back. So it's just a quarter turn, 4 center. So it's very important that we work in the transverse plane because it's where 90% of injuries occur. So training in it can really help prevent injuries and enhance sports performance. So finish up whatever set you're on just so you're even. And then let's set down that lightest Theraband and grab our second to heaviest. You're going to bring that second to heaviest Theraband behind your shoulder blades, coming under the armpits, creating a serve the platter arm position. Guide the chest back towards the shoulder blades, closing the ribs, pull the abs in, keep your focus up eye level. From here, we'll bounce with the ball between the knees. We'll bounce for 4, and then we will kick our butt with our non-dominant heel and go forward for 4 and back, forward and back for 4, and then back to double legs for 4, and then to our non-dominant leg to go forward and back for 4. So notice the center ones where you're kind of you're setting up again. Those are not moving forward and back. Those are in place. And then the single leg work is forward and back. Keep the range of motion small for now. It's a small trampoline and you want to stay safe. So our last exercise, we'll need that lightest Theraband. We can set that second to heaviest down. We'll be pulling out on it, creating a T, keeping our elbows soft, our wrist flat, and our arms within our peripheral vision. We're going to be going side to side now, so keeping a soft bend in the knees. You're going to start with 4 on both feet, shifting to your dominant leg, going side to side for 4, and then 4 on both feet, and then 4 on your non-dominant leg, side to side. We'll repeat this pattern, thinking about our breath, thinking about the knees staying soft, the focus of the eyes up eye level, tipping the tailbone back to keep a neutral pelvis, pulling the abdomen in. If you have sway back posture, bones of the big toes are heavy. The side to side movement can be challenging. Keep the range of motion small. Watch out for droopy elbows. Elbows should be up as high. Well, elbows can be micro bent, but they should be about as high as the shoulders. Be a little below. All right, so let's set up for our first exercise. Lower the arms for a second. We're going to be doing our exercise in the transverse plane. This was the turning plane where you had your serratus anterior hold of the arms. You did 4 center, 4 on your dominant leg, 4 turning, and 4 to turn back. Then you repeat on the non-dominant side. Okay, counting you in for 3, 2, 1. Give it all you got. 100% effort here in the transverse plane. Level 2 trampoline work. Excellent for endurance training, for the lymphatic system. If you know anybody suffering from cancer, if you are suffering from cancer, this is an excellent way to condition your body. One of the highly recommended ways of training the lymphatic system and working on endurance and improving health when you're undergoing chemotherapy. So please refer any of your friends, family, or coworkers that are undergoing chemo for cancer to YouniquelyFit for our trampoline program. So you're almost there. You're working in this transverse plane where 90% of injuries occur. We're building muscle memory, combating the plantar flexion in the ankles and the supination in the feet. Counting you down. 3, 2, 1. Take your break. We're going to repeat this exercise one more time in the transverse plane, but you have a full minute here. So take some water, take a stretch. I'll give you ample time to set up. Anything that needs stretching, now's the time before we begin again. I know holding that upper body still and pulling out of that band for a whole minute is a lot of work. So your upper body may be needing a little extra attention right now. I'm going to let you know when it's time to set up. It's coming up. So let's go ahead and get set up. You've got 20 seconds. I want to give you ample time to get your hands wrapped around those bands so that you can set up in the serratus anterior isometric hold. Once you have it, you can lower it before we begin. I'll count you in. Okay, 3, 2, 1. Soft bend in the knees. Transverse plane first. 4 center. 4 on the dominant leg. 4 turning. 4 turning back. 4 center. 4 on the non-dominant leg. 4 turning. And 4 turning back. So keep this going, keep this pattern going. And now check in with your checkpoints. If you're sway back, the bone of the big toes is really heavy as you press. Your knees are soft. Your tailbone is back, so you're not rounding the low back as you're working. Your abs are pulled in tight. You're lifting in and up on those muscles that stop your stream of pee. Your shoulders are on your back, collarbone wide, head up on the spine. You're doing great, almost there, hang in there. 100% effort, quality of movement, awareness of the core, awareness of your eye focus, counting you down. 3, 2, 1, take your break. As you're taking your break, I'll remind you of our next exercise, traveling forward and back in the sagittal plane. We have our second to heaviest Theraband behind our shoulder blades, wrapping from the ends, knuckles over the knuckles with the thumbs on the outside, creating a serve the platter arm position. Think about the chest reaching for the band behind your shoulder blades And then we begin with 4 bounces with the knees soft, and then 4 on our dominant leg going forward and back, 4 center on both feet, and then 4 on our non-dominant leg going forward and back. Remember to keep your feet parallel, and that means you're from the top of the hip sockets, the leg bones are parallel. Don't rotate from the knees or the ankles. That's going to cause discomfort. Go ahead and get set up. I want to make sure you have enough time. I'm going to count you in 5, 4, soft knees, 3, 2, 1. First set here in the sagittal plane, level 2 trampoline work for sway back and flat back posture. Make sure you're giving me 100% effort, keeping the range of motion small, keeping your focus up eye level. Watch out for that chest spraying forward. Remember, the chest is reaching for that band behind your shoulder blades. You actually have a visual there to imagine the softening happening in the front of the body. Pull the belly button in towards the spine. Tip your tailbone back. Imagine you're laying over that anti-burst ball with your low back. You want to create some extension in your lumbar region. Pull the belly button in. Hear your exhales, soft knees. Gaze up eye level. You're doing great, almost there. I'll count you down. 5, 4, 3, 2, 1. Take your break. Water, stretch, or just stand still. If you're just standing still, make sure you're not sitting into one hip. I want you to work on balancing out those legs by softly bending both knees and staying aware of equal weight distribution between your legs. We have one dominant leg due to a lot of factors, but one of the biggest ones is standing and sitting into one hip, strengthening one side while the other side atrophies. So be aware of this. I'm going to let you know when you've got 20 seconds so you can set up for our final set in our sagittal plane. 20 seconds left. Get set up. I want those arms in the serve the platter position, ready to go. Soft bend in the elbows, soft bend in the knees. I'm going to count you in. 5, 4, 3, 2, 1. Give me 100% effort here. Final set in the sagittal plane. Remember, we're going forward and back. When you're center and on 2 feet, you're not moving forward and back. This is your reset. And then you begin again on the non-dominant leg, alternating. Now, if you really are struggling, I find that my non-dominant leg, it has a lot of catching up to do. So sometimes I'll do extra repetitions on the non-dominant leg just to build the strength and even everything out. So you may want to consider 4 center, 4 on the dominant leg, and then 8 on the non-dominant leg. Something to consider if you do notice a significant difference in the ease of one side versus the other. Keep up the good work. Keep your abs involved. Keep your head on your spine. Apple distance between the chin and the chest, counting you down. 4, 3, 2, 1. Take your break. As you're taking your break, just watch. You need your lightest Theraband, arms in the T, knees soft, 4 bounces center. Dominant leg, 4 side to side, 4 bounces center. Non-dominant leg, side to side for 4, or 8 if you notice a big difference in that non-dominant leg. I myself like to do extra repetitions on my weaker side. I feel like I'm balancing the body out, and that's one of the most important things with exercise, is to fix muscle imbalances. This prevents injuries and it allows you to excel, and it enhances sports performance so you can excel. All right, go ahead and get on up on the trampoline. Bring the arms to a T, soft bend in the elbows, soft bend in the knees, counting you in 5, 4, 3, 2, 1. 100% effort. First set here in the frontal plane, side to side motion. This is a challenging one. You've got that ball between the knees, or rather between the inner thighs, slightly above the knees. You're squeezing it, working those adductors. If you have sway back posture, think about the bones of the big toes being heavy. If you have flat back posture, just make sure that the heels are making contact with the trampoline as much as those toes, the metatarsals. You want those heels to have pressure as well. Keep the bounce low. Don't go crazy on extending the legs fully. And remember that side to side motion, keep it small. Range of motion is not important yet. It's all about control right now. Counting you down. 4, 3, 2, 1. Take your break. Final break before our final burst in the frontal plane side to side. You've done wonderful work. Keep showing up. I'd suggest doing a strength and toning series 3 times a week. We have full hour classes. We have 10-minute options, 30-minute options, and then doing cardio 3 times a week. Always warm up, and I always encourage you to do flexibility afterwards. Your muscles are warm. This is where you can really increase the range of motion, and that's also important in injury prevention and enhancement in your sports. So let's get set up. I'm going to count you in shortly. Remember, we're going side to side. Arms are held in a T in your peripheral vision. Elbows are soft, wrists are flat. Counting you in. 3, 2, 1. Let's give it all you got. Keeping the knees soft, abs braced, tailbone back. Make sure you're not rounding that lumbar. Head is up on the spine. Focus is up eye level. Apple distance between the chin and the chest. Inhale laterally. Tip that tailbone back even more than you think you can. Remember, 2 options. 4 center on both feet, 4 on the dominant leg side to side, 4 center both feet, 4 on the non-dominant leg side to side, or 8 on the non-dominant leg side to side. You choose, but keep your focus up, keep your back involved, keep your abs involved. Remember that the front of the shoulders and the chest should not be gripping. If you need to lose the band because it's too much, lose the band. I'd rather you do that than overwork areas that are already tight. Counting you down. 4, 3, 2, 1. Great work.